Today, I want to talk about the importance of the SEEG. If you've been doing Empower TMS, if I've treated you before, you have received a brain scan. Today, I have Kevin Murphy, PeakLogic, the creator of this technology, correct?
Yes.
Is that fair?
That's fair.
You scanned me 4 years ago and you showed me the benefits of it. And that's really what started all of this. So do me a favor, give a quick introduction of who you are.
My name is Kevin Murphy. I'm a radiation oncologist by training. I'm a doctor that's focused on brain and spinal tumors for my career. And then I started to try and fix the brain waves in some of the kids that had radiation therapy. And that led to this work I do now called PrTMS, personalized RTMS.
Okay.
Yeah.
And you've had this for 15 years?
2013, we started doing this work.
Okay.
Yeah.
Okay.
Yeah.
You introduced the brain scan to the TMS world. Is that correct? Is that fair?
Well, I think there's other ways to do brain scans. The way that we do it is unique. I think we take a non-QEEG. We do a spectral EEG evaluation, which is a rendering of the brain after we take an EEG scan. It takes about 5 minutes to do it. We don't plot the data in a time series like you see with quantitative EEG. We plot the data in one single picture, which shows you all 19 brain locations at once based upon frequency and power.
Why is that important to TMS?
Well, when I first started looking at this, I was trying to look for a dose response curve in the treatment of TMS. Dose response means you keep giving a dose till you reach a maximum and then you stop giving more dose.
Okay.
And that's sort of how all medicine's practiced, but there wasn't one. It was a dose tolerance curve.
Yeah.
How much can you take?
10 hertz, right?
Well, 10 hertz is a frequency, but the amplitude was how much can you handle in 30 minutes. And so it just didn't have some of the, I thought, finesse that it deserved. So we were trying to say, let's look at the brainwave pattern, do simulation, alter these parameters, and adjust the dose.
Okay.
By changing the location, amplitude, frequency, length of the dose, the interval between treatments, it changes the dose. And so that's how we got where we are today.
And that's why it is important, because you're able to give that personalized dose to a patient.
Yeah, so every 5 days we repeat the EEG and we compare them side by side. And the computer says, are you better or not? And what I want to see is more signal and less noise.
Right.
That's called a signal-to-noise ratio, where I want to power up the proper signal, the alpha state, and I want to bring down the agitated states or the depressive states. I want to decrease those.
What are you seeing with the EEG?
So the picture we makes is a rainbow pattern. It shows you all 19 brain locations. Something else I wasn't a big fan of was that the typical QEEG was a 35-page report, looking at normals and Z-scores and so forth. To me, what I wanted was one picture. And my patients wanted one picture. Show me my brain.
Something that's easy to understand.
Easy to understand. So all 19 brain locations are in one view. You can see whether there's good frequency, if there's good power, are they coherent to each other, are the waves lining up to each other, and how much noise is there. I can see it all on a single picture.
What I meant is, what mental health ailments are you able to identify from this scan?
Well, there's pattern recognition, right? Each area of the brain that we look at has a certain function. In some cases, it may be attention span or impulse control. And if my impulse control area is going very fast, people tend to be impulsive. If the impulse area is going slow, I tend to procrastinate.
Okay.
If my attention span is going too fast, I'm hypervigilant. If it's underperforming and slow, I can't pay attention. You might have both. You might be underperforming and overperforming.
Yeah.
That's essentially called PTSD.
Uh-huh.
On one hand, I can't, the engine's sputtering, it's also revving, it never purrs. PrTMS is going to make it purr.
Okay.
So where do you go when you're nice and calm? And we give you that same frequency. We copy your best frequency. I was saying when the patients see their own brain scan, it explains some of their behavior. And I think it's validating. It's very validating for someone to say, I've always had this issue and there it is. It's not really my fault. The brain's not operating properly. And when other body parts don't operate properly, we don't blame ourselves. Generally, we're just like, oh, my knee's bad. But if our brain isn't working properly, then it turns into some of these self-loathing. Why am I like this?
Why am I like this?
Why am I like this? You know, and I go, here's why you're like this.
Yeah.
The scan tells the story.
And it's your brain.
It's your brain. Yeah.
And it can be adjusted.
Yes, it can, Kyle. We can move those waves and tighten them back up.
In the United States, because I do know that you're international, how many people in the United States are using PeakLogic software?
There's probably over 120 installations we've done, research and clinical sites, mostly a mixture of primary care doctors, behavioral health doctors, some research clinics. So, places like yours where you see a wide variety of things.
What about Southern California?
How many do we have? Centers? Probably have 25 in California.
Okay.
25 centers. And then I'd say the majority are, in our region here in Southern California. And then another big group in like Sacramento region.
That's right.
Yeah.
We are the only one in Temecula.
That was where you're going.
That's where I was going with that.
I'm a little bit slow on that.
We are the only one in Temecula to offer this technology.
This is true.
And it's simply because I personally did this technology just over 4 years ago. And the benefits of getting that brain scan originally and seeing it and validating what I knew, right? What I've lived with was so powerful. And that's why I do offer that brain scan for free initially.
Yeah.
Because I want to empower people here in this valley. This is where I'm raising my kids 100%.
Yeah. No, I mean, I think what you're saying makes sense. I think all patients want to see their own scan if you can get one for them. They like to see the changes over time.
Yeah.
It also reduces some of the self-anger or loathing about the condition. Because I can take a scan and say, this is an addictive personality.
Yes.
This is a high risk of having OCD. You're going to have ringing in your ears, likely. You're going to have motor planning anxiety. You're probably fidgety. They're like, how do you know all this? Because the brain scan's telling me that. Now, you may compensate for those propensities, but the system is either tuned and firing properly or it's fast or slow. Fast over-creates and over-manifests. Slow under-creates and under-manifests.
Yeah.
Right.
That's right.
You know all this now.
I know all this stuff personally.
Yeah.
But with that, I want to thank you for explaining that. And as always, man, come schedule your EEG with us and let's get started. Let's see what's going on with you because we would love to help.